Hello.
Is this Delphi?
Yeah, it's Delphi. How are you?
Hey, Mac Longo. Nice to meet you virtually.
Yeah, you too. Sorry, I'm a little late.
Oh,
We had another webinar yesterday, and it's lots of follow up.
I can imagine. This is the world we're living in right now.
Yeah.
So this is a question for you. We haven't used Zoom professionally a lot. We've been kind of WebEx and Teams and Skype. Are people going to see me and see my slides, or just see my slides?
I think they're just going to see your slides.
Okay, that's cool. That's cool.
It's usually
I'm
how it
hired for the first time in 7 months, but I'm okay with it.
Yeah. Yeah.
So, all right, I'm just gonna close out on my emails just so that nothing disturbs me. Discourage changes, okay. And then should I try sharing my screen?
Yeah. Yeah, why don't you do that? I'm trying to figure out who, okay, Lindsay is the other person. Oh, Lindsay's here. Okay, let me admit her.
Okay, so let's just see here.
Are you there, Lindsay? Not yet. Lindsay?
Hi there.
Oh, hi.
Hey, Lindsay.
How are you doing?
Well, how about you?
Good.
So are you guys able to see my screen?
Yes.
I am, yeah.
Awesome. Hello, and I see your face, Lindsay.
Hello, hello. Let me get some better lighting. Oof.
It's pretty bad. Maybe should adjust mine a little bit. The opposite. And then Delphi, do you see both of us and the PowerPoint?
I only see the PowerPoint right now.
Oh, okay, cool.
Yeah.
I told Delphi, Lindsay, that I haven't put a tie on in like 7 months. So
I don't think anybody's expecting any of that.
should I wear my sports jacket?
Artificial.
Yeah.
COVID era.
I'm buying it.
Let's see. And then, so Lindsay, do you have anything like?
Yeah, I'll introduce you.
Okay.
I have a little bit prepared
Okay.
just to sort of set it off.
Sure. And so let's see. So
Hey, I'm unmuted now.
Oh, okay. We're starting now.
Oh, cool. Sounds good. I'm going to go back on mute. I just have one OTV to go do.
Okay.
All right, thanks.
All right, so we'll get started. Hi, I'm Lindsay Puckett. I'm one of the members of ACRO's new practitioner committee. And quick plug for any PGY5 or junior attendings who are watching this. It's a great committee to be part of going into practice. I've been part of it for the last 2 years. So if you're interested, feel free to reach out to me or sign up. As part of the webinar series that we host, it's my pleasure to introduce Dr. Mac Longo. Dr. Longo completed his residency at both Tulane and then at the Medical College of Wisconsin, and has been on staff here since he graduated. He's worked on a number of global health projects, including last year he co-moderated the ICEC Young Investigators Conference, which was pioneering action for global care. And at our institution, he's worked to help establish ties with the Christian Medical College in Vellore, India, which has been really a great experience to have people come over from there and then also have residents go over there. I consider him a mentor for global health, and I'm also fortunate to have him as a colleague and friend. So with that, I'll turn it over to Dr. Longo.
All right. Well, Lindsay, thank you for your kind words and introduction there. I'm also appreciative for ACRO's invitation to come speak to you about global radiation oncology. I have no disclosures other than that I work for the Medical College of Wisconsin. So just an outline of what we'll cover during this webinar. I first want to share with you some of my personal experiences that have led me to pursue global health work professionally, and then want to share the experiences that I had in radiation oncology residency that have helped me to better incorporate global oncology into my career, and then how that has evolved in my early practice of radiation oncology. we'll end our time together discussing some of the challenges that those interested in global oncology face, as well as the opportunities. And I hope to save enough time at the end to field questions from those that are on the webinar. So I grew up within a family and a community that valued service for others, especially those marginalized populations. The high school that I attended in Omaha, Nebraska's motto is "Women and Men for Others," which is a core value of the Jesuits. And that really sparked an interest in commitment to social justice. And for me, that grew during my undergraduate years at Notre Dame, where I worked at Notre Dame Center for Social Concerns and became more engaged with issues surrounding equity and disparities, both in my own communities in the United States as well as those abroad. And that was also my first real exposure to experiential service learning. These experiences ultimately led me to pursue medicine as a career because I knew I wanted to be in a profession that had service at its core. I attended the University of Nebraska College of Medicine in Omaha, Nebraska, and I quickly sought opportunities to engage in social justice work. I was involved in Nebraska's student-run clinic for the indigent, the sharing clinics, as a board member and a student provider. And while I pursued work within my own community, I also sought opportunities to learn more about global health and participated in a number of experiential service learning experiences during my years in medical school, including medical mission trips to Talanchino, Mexico, and Falmouth, Jamaica. During my fourth year of medical school, I spent a global health elective at Tigerberg Hospital in Cape Town. As I was nearing the end of medical school and trying to discern where my calling in medicine was, I felt really torn. While I was committed to working with underserved populations and felt like primary care fields like internal medicine or pediatrics might afford the greatest opportunities to pursue such work, I also felt called to radiation oncology. And this was a question that I struggled with. How can I continue to pursue this interest in global health while simultaneously pursuing a medical career in radiation oncology, a field that I was really drawn to? And this is a point in my life where I really relied on the wisdom of mentors. One such mentor is Carol Swartz, who is a Nebraska grad and a radiation oncologist who has been practicing radiation oncology for almost 60 years. She is a benefactor of the sharing clinics for which I was involved in. And I went to Carol and I said, Carol, I'm really struggling with what to do in medicine. I love radiation oncology intellectually, but I want to be sure that I can really work with underserved populations in a meaningful way. And Carol, stopped me and she said, Mac, number one, you're a physician. You will always have a special set of skills that will enable you to work with those in your own community and beyond. Number two, you're a radiation oncologist. I would pursue the residency that you're most interested in. And those words were incredibly powerful for me and really helped me to kind of take that next step into radiation oncology while keeping an orientation toward global health. So I realized my interest in global health within radiation oncology were and are not unique. In 2014, Lukeman Dodd and others published the results of a global health interest survey that was conducted in 2009. It was administered to all radiation oncology residents. And of those who responded, 89% expressed some desire to pursue a global health experience during their residency. And nearly as many, about 80%, wanted to be sure that international work was a part of their career after residency. And this continued interest in global health has been demonstrated in an update of this survey, which was conducted in 2018 and reported at ASTRO in 2019. Nearly as many radiation oncology residents are interested in global health experiences. And fortunately, there are many more formal opportunities to engage in global health and global oncology, and specifically. But interestingly, residents also reported receiving increased barriers. And I just think that's really interesting that there are more opportunities, but seemingly more challenges to access and pursue those opportunities. So I want to share a little bit about my experience in residency and how I began on this journey of pursuing global radiation oncology. And I really had a three-pronged approach. I sought work within the radiation oncology department at MCW, as well as beyond my department at the Medical College of Wisconsin, and then further through entities outside of MCW. So I think when you're interested in doing something that may not be the norm within your field, which I think at this point, global oncology, it's getting closer, but we're not quite there. It's important to articulate why you want to pursue an endeavor. So for me, it was important to reflect upon why global health mattered to me and why I wanted to make it part of my residency training. So I think a first critical step for me was to articulate a mission statement for myself for pursuing global radiation oncology. And then I met with the chair of the radiation oncology department, as well as mentors within the department, to share this mission statement and my kind of initial goals and get feedback on that. And from there, that really started to precipitate action. A lot of my mentors within the department said, you know, this is really great, Mac. I want to help you in whatever way I can, but this is really kind of out of my league. But I'm happy to connect you with someone who I think might be able to help you. So those initial meetings within my department helped to connect me with others within our field across the country, as well as others at the Medical College of Wisconsin interested in global radiation oncology. And as opportunities arose, people tagged me, or they CC'd me on an email, you know, which led to additional opportunities. One of my first stops after meeting with members of my department was to go to the Office of Global Health at the Medical College of Wisconsin. Most academic institutions will have some form of an office or a department of global health. I think that's a great resource to utilize. You know, many medical institutions have multiple long-standing partnerships across the globe, and it can provide people an opportunity to jump on projects that are already in existence and really continue to grow relationships that are already there rather than starting from the beginning. It also, for me, served as a source of support, identifying potential funds to perform global health work, getting feedback on ideas, and that also led to opportunities to engage campus-wide in global health activities, whether it was working with medical students and residents or learning about other global health research that was being conducted. And, you know, by showing that interest across the campus, you know, people kind of recognized that and, you know, encouraged me to take on leadership roles campus-wide. And, you know, I've alluded to the connections that an Office of Global Health or a similar entity can foster. And those are really critical to meet with people, whether it's formally or informally, that are doing global health, and whether they're in their training or they're fellows or they're in practice. Making those relationships is a great way or a great entree into engaging in more global health activities. So the kind of third strategy that I utilized was seeking guidance and opportunities beyond the Medical College of Wisconsin. And, you know, I've already discussed how important, you know, kind of mentorship within my department was as I was pursuing this in residency, it was equally critical to seek and foster mentors outside of MCW. And for me, two of my most important mentors are Dan Peterite, who is a radiation oncologist in private practice in Rapid City, South Dakota, and then Norm Coleman, who is at the NCI. And I'll discuss how both gentlemen have impacted me shortly. Another venue that can be really supportive of global health work is our professional societies. Certainly those within the field of radiation oncology, including ASTRO and ARROW, for those of you who are in your residency. I became engaged with the ARROW Global Health Subcommittee first as a member and then as one of the co-chairs of the committee. I also was invited to participate as a member of the ABS International Committee. And I actually regrettably did not get very involved with ACRO during my residency training, but as you may be aware of, ACRO has funding for those residents that are interested in pursuing global health electives or experiences. So, I think, and there are many other professional societies beyond those mentioned here that can help with global health efforts. Beyond professional societies, there are NGOs and organizations that are doing global oncology and specifically global radiation oncology work, one of which I am a member is the International Cancer Expert Corps, or ICEC, and I'm a member as an early career leader and have been so since 2014. Another great organization is Radiating Hope, which has made it their mission to install equipment in countries and ensure that it's able to effectively deliver care there. Mira Shah, who was originally on tap to speak with you all today, is a board member of Radiating Hope, and it's just a really inspiring organization. Finally, as you kind of dip your toe in the global oncology waters, you recognize that it's a small but inviting community. And by putting yourself out there, that can lead to opportunities like writing papers, being a part of committees in the professional societies, or being even invited to speak, such as this afternoon for me. And all of this work really culminated in two seminal global oncology experiences that I had during my residency training. I was connected to a palliative care physician at MCW who worked in Uganda and just in passing had met the radiation oncologist there. I first had a conversation with her in July of 2013, and a year later I found myself in Kampala, Uganda, at the Mulago Department of Radiation Oncology for a 1-month global health elective. Now, this was a new experience. MCW didn't have an existing relationship with the Department of Radiotherapy at Mulago. And so I tried to set reasonable expectations for what I would accomplish during this time there. For me, I really wanted to learn what radiation oncology was like in a low-income country. I wanted to share what I could as a resident, and I felt like that was largely through providing, a series of lectures on how we do things in the United States. I did not have a set research project going into this experience because I recognized that it was only a month, and that I think one of the key facets of doing global health work is that it takes time to build relationships, and I didn't feel like I could justify even a short-term research project before I had even met the members of this department. I will tell you, it was a complete culture shock to work at Mulago. The clinic was teeming with patients who had traveled from all over, not just Uganda, but surrounding countries like South Sudan, Congo, Rwanda, parts of Western Kenya. Each morning you would arrive to a jam-packed waiting area. The clinic treated about 20 hours a day using one cobalt machine that had been donated from China in the early 90s and had not had its cobalt source replaced in over 10 years. So you can imagine that delivering 8 gray in 1 fraction took a very, very long time. I was shocked by some of the presentations of cancers that I saw, very advanced lesions like you see this large left leg mass, sarcoma, advanced breast cancers. The inpatient setting was different than what I was used to in Milwaukee. Patients kind of line the hallways. Their family members often slept under their hospital beds, and they were in charge of providing food and hydration and filling prescriptions. It was a lot to take in visually, audibly, and I was kind of thrown right into the clinic setting. After the first day, I was given charts and tasked to see and care for patients on my own, which at many points felt quite overwhelming. I also was surprised that by about midday, the patients were still there lined up, but a lot of the physicians had left. And my initial response was one of judgment. And I said, how could these doctors leave while all these patients are still here? And I scrambled to try to see as many patients as I could. And I really, even felt some anger there, and just I couldn't understand how people could do that. I'm glad I sat with that a little bit, because I then began to, recognize that this is not Milwaukee or MCW or the US, and that there are different resources that are accessible, and that all were trying to do as much as they could to help people. And I think another kind of key point I learned there is to really limit your initial judgment and try to come from a place of understanding rather than judgment. I learned a lot about 2D planning, which is something that, those that have trained in, the past 2 decades really have very limited exposure to. So, as the month kind of went on, I started to kind of fall into a rhythm, and I really came to value my time spent with my colleagues there and the patients, and recognized that I really could offer the department there very little. I did spend time giving various lectures to residents and faculty, which was really engaging and really fun. But what I could do for them was very limited, and that experience really has shaped what I have done since then. Another experience during residency that had a significant impact on me is one in our own country. A little over a year later, I spent a week working with Dan Peterite, who, as mentioned, is a private practice radiation oncologist in Rapid City, South Dakota, who is committed to addressing the disparity that Native Americans on the Pine Ridge and Rosebud reservations experience in regard to cancer. Since 2002, Dan has been the PI on an NCI-funded grant called Walking Forward, which is seeking to increase access to care, access to clinical trials, and assist with patient navigation for the Native American population of Western and Central South Dakota. And what was so interesting is that many of the challenges that I recognized in Uganda, lack of access to oncology centers. Pardon? So lack of access to cancer centers, traveling great distances in order to receive care, and the challenges with transportation and housing, lack of understanding and awareness of cancer were similar to the challenges that I saw during my week with Dr. Peterite. One day we drove between Pine Ridge and Rosebud, visiting various sites, including the Indian Health Service Hospital in Pine Ridge, clinics. We made some home visits. We put over 400 miles on Dan's truck. So you just get a sense of the vast expanse of territory that Dan really serves from Rapid City. And another thing that I found really interesting, which I think informs really, certainly informs global oncology, but I'd argue that any sort of cancer care, is the impact of other events and other challenges on indirectly and directly on cancer care. We stopped at the cemetery at Wounded Knee where 300 Sioux Indians were massacred by the US Army in 1890. Really a moving experience and just a recognition of how an event that occurred 130 years ago still has a palpable impact on the way the Native Americans are living today. So, these were experiences that really kind of affirmed my commitment to include work with underserved groups, both down the street, across the country, and across the globe into my career as a radiation oncologist. But I didn't glide right into this global radiation oncology as a faculty member at MCW. I would say I kind of took a turn onto a gravel road. And in many ways, a lot of the exploring and the kind of slog that I pursued during residency was repeated during my initial years as a faculty member. And I took the same three-pronged approach where I worked within my department, within MCW, and then beyond MCW in order to kind of get where I am and am going today. So just like I mentioned in residency, it was equally critical that I refined and expanded my mission statement for why I wanted to pursue global radiation oncology. And once I was able to do that, I needed to set up meetings with my department leadership in order to learn if this was something that they would support. Did my commitment to global oncology align with the department's goal? If not, or if it doesn't match up with what your practice wants to do, then maybe you're not in the right place to pursue global oncology. Secondly, I had to gauge what sort of support I would receive. And that support comes in both financial support to travel or to attend meetings or to, send in papers. But perhaps more importantly, would I have the time to pursue this work, as part of my academic obligations? And after doing so, I thought it was important to set some goals for kind of collaboratively what my department sought from my work in global health and what I was hoping my department would help support. And this importantly has enabled action. And Lindsay discussed some of the efforts that I pursued within my department, but I'll just briefly discuss them with you. One program is the development of the MCW International Scholars Program in radiation oncology. Historically, MCW has hosted international visitors, both clinicians, physicists, and researchers over the years, but it was kind of hodgepodge and scattered and not well organized. We developed a formal non-degree program to make it easier for international visitors to have a good experience and also to make it easier for our department to host them. Since the program started in November of 2017, we have hosted 8 international scholars from 4 different countries: India, China, Hong Kong, and Canada. And they've been a mix of trainees, practicing radiation oncologists, as well as physicists. And this has been a really, I think, an all-around good experience for both participants as well as our department. Lindsay also mentioned the relationship that we have developed with Christian Medical College in Vellore, India. Now, you'll notice here that I'm not talking about a relationship with Mulago Hospital in Kampala, Uganda. Unfortunately, that relationship didn't continue. And I think that, illustrates something that's important to consider as you're pursuing global oncology, is that I was the first one to make that relationship. It wasn't one that my institution had. And due to a number of reasons, it wasn't one that could be sustained. So as I've sought to build another relationship, those were kind of critical questions that I asked. Is this one that is going to be mutually beneficial? Does Christian Medical College want to partner with MCW? And is it sustainable? Is this something that can persist even if I were to go on? And fortunately, I think we have found a willing and wonderful partner in Christian Medical College. Just due to time, I'm not going to kind of stay here on our partnership with Christian Medical College. I just want to kind of get to the end of the kind of remainder of my talk here. I've also become very engaged with global health work beyond the Department of Radiation Oncology. And that's been a really rewarding aspect of my academic work here. I helped to design and deliver the global ethics and cultural competency course that all MCW students and residents and fellows have to take before they have their global health experiences. I'm a mentor to MCW medical students that are involved in the Global Health Pathways curriculum, and that involves facilitating journal clubs and giving lectures and mentoring students individually. I serve as our department's global health liaison for the Office of Global Health, and I've continued to foster relationships with my mentors as well as become a mentor, which has been a really fun part of the past 4 years. And I've also worked outside of MCW, mentoring others that are not at my institution. I continue to be engaged with ASTRO and ABS, and probably my most substantial extra institutional efforts are with the International Cancer Expert Corps. And as Lindsay alluded to, I was a co-chair of our Young Investigators conference that was held in February in 2019, which brought together almost 200 people from all over the world, not just the United States and Canada, but Europe, multiple countries in Africa, India. And this was a really powerful conference to be a part of. And I think one of the aspects I'm most proud of is just how it really gave voices to our partners in low and middle income countries. And I think this picture also speaks to the global oncology community that I have now become a part of. This includes people like Mira Shaw, Serbi Grover, Danielle Rodin, Onyi Balagan, and others. It's just a really great group of people to support and be supported by. So, I don't want to paint an entirely rosy picture of what it's like to be a global radiation oncologist, because there certainly are many challenges that I and others who are pursuing this work are continuing to navigate. One is just the sheer scope of the problem. The incidence of non-communicable diseases, including cancer, is rising, not only in high-income countries, but in low and middle-income countries, which are far less equipped to address them. Paul Farmer noted in a Lancet Oncology publication in 2010 that 80% of disability-adjusted life years lost globally from cancer are in low and middle-income countries, but only 5% of those resources are devoted to LMICs. And we know within our own field of radiation oncology, there's a huge deficit in access to linear accelerators even. As this map identifies, the countries that are in red, orange, and yellow are those that have either no LINACs or a very limited number of LINACs, which does not meet the needs of their population. So not only is there this huge gap in equipment, there's also a lack of human capital. We don't have and are not training the radiation oncologists, the physicists, the therapists, the nurses, to be able to operate safe and effective radiation centers in low and middle income countries. So one might, say, gosh, this problem is just so daunting. I don't even want to look at it. I'm just, gotta put the blinders on and focus on the challenges in my own clinic. I think another challenge is that within our own country, there are vast disparities. Sherwood and McClelland had a really nice series of papers and advances in radiation oncology, which just highlights the oncologic disparities amongst African Americans, Native Americans, Hispanics, and those in Appalachia within our own country. And oftentimes I get the question, Mac, why are you going to India or to Uganda when in your own community there is a lack of access and there are poor cancer outcomes? And that's a fair, good question. Thirdly, I think this is something that we all experience in all aspects of our practices, is just that there's a lack of resources, and that includes both time and money. We're all scrapping for funds and being urged to tighten our belts and see more patients, and activities that may be outside of the norm of your clinical practice are encouraged to be pursued late at night and on the weekends. Shakina Elmore, who's another global radiation oncology star, published the results of a survey of radiation oncology residency program directors that demonstrated a great interest in supporting residents in doing global radiation oncology until it came to providing funding and time to do those activities. And as Shakina noted, work will be completed on borrowed time without sufficient funding. And finally, this is an unconventional career path. It's not the typical clinician scientist or clinician educator. It's not the typical pathway of someone who's in private practice in radiation oncology. So without a framework of how to pursue a career, it can lead to just even more stumbling blocks and limited support. But I'd argue that with these challenges come a whole set of opportunities for unique solutions. And, we talk about the scope of the problem of the global burden of cancer, but what about the scope of the solution? I think in radiation oncology, we pride ourselves on being innovative thinkers who tackle big problems and are at the leading edge of science, medicine, and technology. What greater problem than to improve the access to and quality for cancer care? I think that we have to recognize the moral and ethical imperative. This deficit in care, whether it's in our own communities or internationally, is leading to excessive suffering. And I think as physicians and caregivers, that we need to be reminded of that. Regarding the kind of questions I get about why are you doing global when there are problems in your own community, I don't think they are separate. I think that that there are many connections between the challenges we face in certain metropolitan areas or rural communities that are shared with our international colleagues and cancer patients, and that addressing global oncology disparities can lead to similar efforts within our own underserved and marginalized communities within the United States. I think global oncology work is complementary to addressing local disparities. I think that we need to think about how we distribute our resources, and if we value the cancer care of all, then I think we can creatively find ways to address and redistribute those resources. Finally, many of my colleagues are working to develop a more defined career pathway within global radiation oncology, both within an academic setting as well as in private practice, and developing metrics and really emphasizing that this work is translational and that it needs to be evaluated from a different perspective than kind of other oncology endeavors. So I'll conclude by acknowledging that what I've shared with you during this webinar has been my unique experience, and that's what I can really speak to best. There are many others within our field, well, not many, but some others in our field who are doing excellent global oncology work, and it ranges from, my colleague Brandon Fisher, who is on the board of Radiating Hope and in private practice in Utah, to Serby Grover, who is nearly full-time with UPenn in Botswana, and there are different models between, but this has been my experience. Some strategies and insights that I'll leave you with is I think it's really important to articulate why you want to pursue global oncology and really develop that mission statement. I think the approach that I've taken to kind of start in my most immediate circle and then expand my inquiries beyond that has been an effective one for me. I really stand on the shoulders of my mentors, both at MCW and beyond, and have relished in being a mentor to students and residents. I think framing these hard problems as exciting opportunities to better serve people helps you kind of work through them. And I think remembering humility, listening to partners, and really advocating for the voices of those both providers and patients in low and middle income countries is critical. Now, the title of my talk was, what is a global radiation oncologist? And I feel like I really danced around that definition. And what I would posit to you all is that we are all global radiation oncologists, whether you partner with our colleagues in Europe, or you're part of an MR-Linac consortium, or you see a patient who was a refugee in your own clinic here in the United States, or you are seeking to have a global health experience. We live in an interconnected world, and a global radiation oncologist serves cancer patients wherever he or she is. So with that, I just thank you for this opportunity to spend time with you today, and I'm happy to answer any questions anybody has.
Great. Thanks so much, Mac. That was really great. Yeah, we do have time for a few questions. So if anyone has anything, I'll be quiet for a second and let you ask.
Hi, this is Dwight Heron. Can you hear me, Mac?
Oh, hi, Dr. Heron.
Hi, how are you? Good to see you, by the way. Congratulations on all the work that you've done. I saw this come up on the webinar, and I obviously had to come in because obviously the history that I have with not only Dan Peterite in the Cancer Disparities Research Program, looking at the disparities in the U.S., but you can look globally, but the truth be told, we have a lot of those disparities right here at home. So question I have for you, and again, congratulations on not only, through training, being involved in this, but also now that you are an attending, sort of doing the same thing. I think that's really important. Question I have for you is, how do you encourage and motivate trainees and junior faculty to promote a global health perspective, recognizing, as you said, we're all globalists, the global radiation oncologists, but it takes a little bit more. How do we encourage junior trainees and junior faculty to, I'm looking for some guidance.
Yeah, and that's something that I have thought a lot about because I recognize how invaluable these opportunities and the exposures that I have had within global health have been, and how they impact the way I take care of my patients in Milwaukee at the VA, or in the suburban clinic I'm at right now. So one strategy is just to get the word out. In an academic institution like MCW, there are obligations to give talks and grand rounds, and mine are usually centered on global oncology. And I always try to connect the work that I or others are doing globally with the work that is being done on the ground in Milwaukee, because I think it's really critical that we just address cancer inequity everywhere. And I think that that people it's easier to dismiss something that's far away when you have problems right outside of your door. But I think if you can make that connection and highlight that, and highlight the impacts on clinical practice, that has been one strategy that's been effective. I really valued the mentors in my life, both within medicine and outside of medicine. And I think another piece is really fostering relationships with students and with trainees who show an interest, because this is not a well-trodden path within radiation oncology. So
yeah.
I really kind of make the extra effort for those that show an interest. So I think getting the word out within your department, whether it's through talks or just reminding them of global oncology opportunities, and then taking that extra effort with anybody that's even remotely oriented to global health is what I've been trying to do, and I'm still developing better strategies.
Do you think if it's worthwhile to take this to like the chair of department, so it's something like SCARAP, to kind of start encouraging folks to, because it really starts at the top of your department, does have to support something like this if you're in academics. It's a little bit harder in private practice, not to say you can't do it, but I'm just trying to think of what are ways. I know Norm is trying to do this through Astro as well, but the question is it even possible to do something through ACRO as well? What are the things that we can do structurally to kind of encourage people? And I'm, again, just trying to think of how to do it.
Yeah, I think we've kind of been beat on the doors to say that this is global oncology, cancer disparities is important, and sometimes you feel like that door doesn't budge. I think that certainly capitalizing on this year's Astro, which is centered around global oncology and kind of carrying that momentum is critical. I think that I wish I had a better, more effective strategy. I think one thing that we're working on is really kind of formalizing a global oncology kind of metrics for how you build a career in this. And again, it's centered within academics, but it's not exclusive to academics. And I think it can be applied in some private practice settings as well. To demonstrate its value. And another strategy is I've really utilized mentors outside of my department. I talked about how involved I've become with MCW's Office of Global Health, but it's other leaders at our medical center that might not be, even in oncology, but they have influence. They have they can provide support, and I think it raises an eye when you're meeting with the dean of students or the president of an organization to talk about your efforts. And if you kind of go from your clinical practice and skip the chairman, they'll say, oh gosh, I should be more aware of this and know what's going on and maybe support. It's incremental and it requires patience and time.
Great. Thank you for that great answer.
Thanks, Dr.
I had a quick question. This is Dr. Andrea Arnett, radiation oncologist at Ohio State University. I'm trying to kind of expand our department's interest in global health, and it's been an interesting journey as a junior faculty member. But this kind of ties into what you're saying, I think. Where do you look for funding mechanisms and resources? Because you really have to get creative here. I mean, I know obviously you can do generalizations like philanthropic organizations, relief funds through the government, but I mean, it's hard for me to find specifics, and also it would be great to hear how you think creatively to tie the project you want to get done so it relates to the funding that you may or may not have available, and how you've worked around some of those things.
So my primary workaround is seeking projects that don't require a lot of funding. So where I focus my efforts have been on educational collaboration, such as building this partnership with Christian Medical College, where we do have some funding to send residents and medical students to Vellore in India, as well as reciprocal funds to host trainees and clinicians from Vellore at the Medical College of Wisconsin. That doesn't fund the entirety of their travel expenses, but it's substantial to help make it happen. But otherwise, our partnership is centered in education and learning from experiences, developing virtual lecture series, kind of best practices. We have not built a lot of sustained research collaborations that may require more substantial funding. And I think another reason that has not happened is that it takes a lot of time to build these relationships in order for them to be meaningful and mutually beneficial. And I think one of the challenges that I personally have faced is that a lot of our metrics of success in kind of radiation oncology in the United States they're pretty short timeline, and it's doesn't always align with building something that is sustainable and mutually beneficial with global partners. So to answer your question, I have not sought or needed a lot of funding to do what I do, because I've tried to develop partnerships that don't require it at this time. I think someone who could speak more to that would be Serby Grover at UPenn, who has support from both Penn as well as grants. And that's been kind of a totally different avenue that Serby has charted successfully.
Thank you very much.
Great.
Hi, this is Amit Shah. I'm a radiation oncologist. And my question is necessarily doesn't apply to the young residents. I am in second half of my career, and I'm trying to look at what I want to do when I don't want to work full time.
Mm-hmm.
And I'm trying to learn how I can get interested in serving. Certainly, I would have my own financial resources to provide the trip, so funding is not an issue as far as personally getting involved. So just wanted to find out what advice you can give me as to how to get started to evaluate potential opportunities for involvement.
So that's a great question, and I'm glad you asked it. One kind of resource I will plug is the International Cancer Expert Corps, ICEC. Not only is ICEC seeking to support people like me who are early in their career or practice, but they also are looking for senior mentors, so those that are at the end of their radiation oncology practice or even retired, to serve as mentors to radiation oncologists both in the United States and those in low and middle income countries. So certainly I would direct you to ICEC as a potential opportunity for engagement. And then as you're kind of trying to identify how to help, I would discourage you from doing what I did, and I just went to Uganda for a month. I'd look for global health opportunities that are already well established and where there's a clear need for someone like you. And I think that's where working with Radiating Hope in their commissioning projects, or partnering with, and say if there's an academic institution that's nearby that has a program that kind of plugging into entities that are already established, I think is another bit of advice I'd have.
Great. And one other write-in question from, it looks like Amar Rawari. He's asking if, apart from Fulbrights, if there's any other fellowships or other experience in global health that would be of interest to those in early or mid-career.
Yeah, so mid-career, that's I'm not certain of a bevy of opportunities. I think for residents, I do want to just make a plug for a couple of things. One, Shakina Elmore really pioneered participation in the Homan pathway as a global health scholar. So traditionally that's been clinical research or clinical science, but Shakina participated as a global health scholar. So that's an opportunity for residents. There are internships available through the IAEA in Vienna through their radiation health branch. And that's something I explored during residency. It just didn't line up with other things. And I have to say, it might be an opportunity for those that are earlier in their career that want to take a substantial period of time to delve more deeply into the kind of big picture implementation of radiation care, especially in low and middle income countries. Those are kind of the big ones that come to mind. So a little more for trainees. For those early and mid-career, I'm not as familiar with any.
Great. Yeah, thanks so much, Mac. I saw Delphi had put up the link for Radiating Hope. I think one way that anyone who's interested, it's just a great way to link up with that global health community. And obviously, if you can financially support it too, their membership is relatively affordable and goes towards a good cause. Other than Radiating Hope, you had also mentioned the ICEC.
ICEC, yep.
Yep. And perhaps we can get a link for that too if anyone's interested. in signing on. Any other questions? Great. Well, one more plug. If you're a resident, be sure to look into the ACRO Global Health Scholarship. For me, that was a huge step in residency, and anyone's welcome to apply for it. You don't have to be an ACRO member. Astro also has a scholarship in this regard. Not long ago, thanks for talking with us.
Hey, thanks everybody. Have a great rest of the day.
Thanks so much.
Thank you.
Thank you.
Thanks, guys.